All right, so you're reviewing your patient's medical history and you see diabetes. What does that mean for us? Well, first thing you need to know that there are two types of diabetes, type 1 and type 2. Type 1 we usually see in childhood. Type 2 develops later in life, usually because of poor lifestyle choices. So, when somebody has a condition known as diabetes, what it means is that when we eat, the sugar from the food that we eat is put in the bloodstream, and there is a hormone known as insulin that will take that sugar out of the blood and put it into the cells where the body can use it for fuel. In type 1 diabetes, there is no insulin. In type 2 diabetes, there is insulin, but the body is not using the insulin the way it should. So the blood sugar is still high and the cells are still lacking the energy that they need because the insulin is not taking it out of the blood and putting it into the cell. Now, what does that mean to the oral cavity? First of all, people with gum disease, uncontrolled periodontitis, it's going to find it very hard to control diabetes. And if you have uncontrolled diabetes, it's going to be very hard to control periodontal disease. Which came first, the chicken or the egg? We're not sure, but guess what? If we can make sure that those gums are healthy, it's going to help the diabetes, it's going to help the periodontal disease. Secondly, sometimes diabetics can have a decreased amount of salivary flow. And we know that saliva flushes and cleans. And so if that salivary flow is less than it should be, those folks are more prone to tooth decay. Thirdly, all diabetics have slow wound healing. So any wound is going to take a longer time to heal. Any extraction is going to take longer to heal. Any cut in the mouth is going to take longer to heal. Any kind of oral surgery is going to take longer to heal if the person is diabetic, especially if it's not controlled. And the last thing is, heard this word thrush? It's a term that we use when there is yeast infections in the mouth, So there'll be white patches usually on the tongue, sometimes on the cheek, and it can alter the taste. Just not a good scene. So we have a couple of things to watch out for diabetics. So when you see diabetes checked off on that medical history form, now you know what it means.